So guys, with us today with Make It Make Sense, we have CMS Administrator Chiquita Brooks-LaSure, and I am really thankful that she has taken the time to come to our show, Make It Make Sense, where what we try our best to do is take complex topics, things we need to know, and give you the who, what, where, when, why of it, so that we can all live better lives. So if you could tell us, because I know there are people who first have no idea what your department is and what it does and what that means to us now.
And just thank you so much for having me. I am the CMS administrator, and our agency is responsible for overseeing healthcare for over 150 million people. So if you are enrolled in Medicare, if you are enrolled in Medicaid or CHIP, or if you are enrolled through the Affordable Care Act marketplaces, so if you go to healthcare.gov, we are responsible for making sure your coverage is working for you. And it is such a privilege to be in this role right now, because healthcare is more important than ever. Just everything that's going on in terms of us getting through this COVID-19 pandemic, to addressing health equity and the disparities in our communities across the nation. CMS is at the forefront of really trying to make sure that we address those disparities.
And what does CMS stand for?
The Centers for Medicare and Medicaid Services.
Yeah, and that is how many people who are receiving those services in our country right now?
150 million. So because of the work really of the Biden-Harris administration last year with increasing enrollment to 14.5 million people through the Affordable Care Act, millions on Medicaid and CHIP, 80 million people are covered through their states programs. The role of CMS has really grown over the last couple of years.
And how did that role relate to the receipt of medical services surrounding abortion?
So in our programs, the Medicare, Medicaid and CHIP, and marketplace coverage, abortion coverage is very limited. It is limited for the most part in Medicaid and Medicare to instances where abortion is as a result of rape, as a result of incest, or when the life of the mother is in jeopardy. And so in those instances, the Medicare and Medicaid program are permitted to cover it, required to cover it. If you have private insurance, it depends. If you enrolled in a health plan that offers abortion, then you're able to and most insurance companies provide abortion services. A lot of our role around reproductive health is around making sure that women have access to birth control, and that is the full range of birth control, which, as we all know, is more important than ever. And so we as an administration are really trying to emphasize just all of the ways that your insurance company, that your states should be providing birth control coverage to you free of charge. That said, across the administration, we are very focused on assuring the right for people to determine their own health. And our website, reproductiverights.gov, gives women really a roadmap to making sure they know what their rights are in this country, and in terms of the full range of reproductive health, including abortion.
And that's at reproductiverights.org.
.gov.
.gov, G-O-V,
yes.
reproductiverights.gov.
So it's a government website.
If I look at my home state of Texas, the situation is the worst of the worst. I grieve for the young women who are dealing with things there now, and people are saying that the next thing that they're going to try to do is interfere with access to safe other methods of sex, safe sex prevention of childbirth, as opposed to needing the abortion, which to me makes no sense, but that is where we are. That right now, though, is illegal. Am I correct?
That's right. So the Supreme Court decision, while of course very far-reaching and really concerning, absolutely did not address contraceptive coverage. And that is the law of the land in terms of people's access to contraceptive coverage. What is also the law of the land is that the Affordable Care Act requires most insurance companies to provide that coverage. And we are working as hard as we can to make sure. We had a meeting earlier this week with insurance companies, reminding them of their responsibility to make sure that people have access to the full range of contraceptive coverage. Again, that includes IUDs, it includes emergency contraceptive coverage like Plan B, and as well as the other contraceptive coverage like birth control pills, et cetera. So we really want to make sure that people know that they have access and a right to get these services. But it is very concerning because this decision was a huge step backwards in terms of our rights under this country. And we must not only stay vigilant, but recognize that we're going to have to continue to make sure that everyone really understands just the implications of rolling back this right.
And if someone feels that they're, for whatever reason, or is having trouble with getting access to these services and they are covered under CMS, what is the best step? Like who do they call first? No pass go.
So there are a couple of options. We have an Office of Civil Rights, and you can go to on reproductive.rights.gov should give you a connection to our Office of Civil Rights. If not, it's on www.hhs.gov, and you can find our Office of Civil Rights there. I would start there, but you can also go make a complaint to your insurance company. You can make a complaint to your state if you trust your state insurance office, or your state Medicaid office, depending on what type of coverage. And of course, you can always contact CMS, and you can contact us in numerous ways through our website, as well as calling our call centers. Even though it's not about Medicare per se, if you called our Medicare number, we would route you to the appropriate place.
Wow. Well, I am so thankful for that, because so many people are just nervous. And even if they aren't in significant danger of losing one of the rights they've been accessing or services that they've been using, they want that assurance. So we really appreciate you taking the time to stop by with us and make it make sense.
Thank you for having me and just what you're doing.
All right. Take care. Have a great day.
You too.
Bye-bye.